Thank you all for joining us at Beyond the Hype, what the research about social media tells us. We're excited to have an amazing panel convene today to discuss what we know about the relationship between social media and youth mental health. Before we get started, there are a few administrative items that I want to walk through. My name, by the way, is Dr. Dave Anderson. I'm the Vice President of Public Engagement and Education at the Child Mind Institute. First, we'd like to thank our partner and funder, the State of California's Department of Healthcare Services, for supporting our work at the Child Mind Institute and discussions like today. Without their support, webinars like this wouldn't be possible. Second, we'd like to thank Northwell Health for sponsoring and providing continuing education credits for this event. If you would like to receive CE credits for attending this webinar, you will need to log your attendance by scanning the QR code that is on screen right now at the beginning and at the end of the webinar. To maintain the ability to provide CE credits, we'll be reaching out after the event to ask you to fill out a brief survey. So please fill out the survey when you receive it. So on to the meat of our discussion. In my role at CMI, I get to speak to a lot of parents, educators, and policymakers around the country. And one topic that we find is universally on folks' minds is what to do about social media and what the intersection might be between social media and youth mental health. We hear questions about whether or not a child or teen's access to the online world or to social media is making them more healthy or making them more depressed, how it might impact their self-esteem, and what kinds of restrictions folks might place on these or monitor use more closely. These sorts of concerns have risen to the top of everyone's minds, especially over the course of the past year, and with many of the media narratives surrounding social media and mental health on a national level. So I'm excited to facilitate this conversation today with 4 leading experts on this topic, as well as a representative of youth programs at the Child Mind Institute and youth programs nationally to add to this discussion. Dr. Jessica Schleider is the founding director of the Lab for Scalable Mental Health and associate professor of medical social sciences, pediatrics, and psychology at Northwestern University. She also serves as Director of Digital Services at Northwestern Center for Behavioral Intervention Technologies. Her research mission is to build, test, and disseminate scalable evidence-based mental health solutions that bridge previously unfillable gaps in mental health ecosystems with a focus on single-session interventions for underserved youth. Welcome, Jessica. Dr. Pete Etchells is a professor of psychology and science communication at Bath Spa University in the UK. He has published several books on the behavioral effects of video games and digital technology. Most recently, his book Unlocked, which examines our relationship with screens and the research involved. And as we're hearing, Unlocked may be available for sale in the US as of either tonight or tomorrow, which is very exciting. Welcome, Pete. Dr. Candace Odgers is a professor of psychological science at UC Irvine. She is a quantitative and developmental psychologist with expertise in adolescent mental health, intensive longitudinal data analysis, and experience sampling methodologies. Her research focuses on how early, daily, and online experiences influence children's health and development. She has published a number of widely circulated articles this year examining the impact of social media on youth mental health, including her piece, The Panic Over Smartphones Doesn't Help Teens, in The Atlantic, and her widely circulated Nature commentary on whether social media is really behind the epidemic of teenage mental illness. Welcome, Candace. Dr. Mitch Prinstein is the Chief Science Officer of the American Psychological Association and the John Van Cedars Distinguished Professor of Psychology and Neuroscience and co-director of Winston National Center on Technology Use, Brain and Psychological Development at University of North Carolina at Chapel Hill. A board-certified clinical psychologist, Dr. Prinstein has published over 200 scientific manuscripts and 12 books, and his work has been featured by the New York Times, NPR, CNN, and other media outlets. Kelly Nin is an intern in the Center for Product Development at the Child Mind Institute and a member of the 2023-24 Youth Mental Health Academy cohort. She recently graduated from high school and plans to attend university, where she'll be majoring in molecular, cell, and developmental biology. Kelly has experience with research-based projects such as the Orange County Science and Engineering Fair and the Toshiba NSTA Explore Vision STEM competition. And I didn't say welcome Mitch right at the end, so welcome Mitch and also welcome Kelly. So just to highlight some of the framing for this panel today, with study design input from our panelists today, the Child Mind Institute actually conducted a survey earlier this summer of parents' perspective on youth and social media use. And the results of this survey actually mirror a lot of our national discussion. Parents were asked to reflect on their kids' screen habits, mapping their time spent in academic and personal activities associated with screens, as well as positive effects and major concerns about screens and social media. While there are many interesting nuances of survey results that likely will be highlighted in future publications, these are a couple highlights. On average, a little more than 50% of surveyed parents note that they think social media could be a positive influence in their child's well-being. Now, this may be surprising to many in our audience that a little more than 50% of surveyed parents think this. But what far outweighs this is the fact that over 80% of the parents surveyed report concerns about barriers that would prevent social media from being a positive force. And this really mirrors a lot of our national discussion. The factors that parents highlighted as being those barriers to social media being a positive force also are reflected in the Surgeon General's recent advisory around social media and the research that we know of about kind of negative effects that can occur with parents' concerns, including cyberbullying and hate speech, exposure to harmful content or age-inappropriate content, and excessive use of social media. So with that as background, we want to understand our digital lives at a deeper level. And we also know that concerns loom large, particularly with things like the digital space that are new and evolving as quickly as we can possibly understand it. So to pivot to our discussion today, after that bit of intro where you were bearing with us through me introducing our esteemed panelists and highlighting our survey results, I want to open a question to the panel. So for all the experts, what I want to highlight is first, what to you does the science say about the impact of social media on youth mental health? And what are some of your top points? Mitch, I'm going to start with you here. What would you like to highlight about social media and its intersection with youth mental health?
Well, there's a lot of science that's been going on for a number of years, but let's remember that this is a pretty young area of science. So I would say that the most important thing to take away is we don't know yet, right? We are still learning. I think there is very little evidence that social media has single-handedly caused the entire youth mental health crisis. I don't think many are, there's a lot of data to substantiate that. Also important is that social media is not one thing to every single child. So a better question for parents and for policymakers to really think about might be, what are the kinds of behaviors, experiences, content features on social media that could be good for some kids? What are some of the experiences on social media that could be bad, maybe for some other kids? And when you look at it that way, we and at the American Psychological Association have started to put together a few warning signs and a few areas where we would encourage more adaptive use.
We're going to get into those in 1 second, but just, giving each panelist an opportunity to kind of highlight top-line themes. Candace, do you want to highlight a few of your top-line themes for us at this intersection?
Yeah, I agree with Mitch. The science really is unsettled. I think one of the most interesting things for me working in this area really isn't about a specific finding, but it's been about the distance. And when I say distance, I mean the distance between what the bulk of findings to date have really said about the association, which is they've said there's tiny associations. We don't know, cause and effect. We have a hard time sorting that out. There seems to be some areas of concern, and like Mitch said, variability across people, but the distance between that consensus and the scientific community, although it's still evolving, and then what people are told and what people believe when you ask them or they reflect on it. And that is a really fascinating disconnect for me.
And to turn to another panelist here, Pete, you unpack a lot of that even in the first couple chapters of Unlocked. So if you'd like to highlight some of your themes here, I'll open the floor to you.
I think we're all kind of in agreement here to begin with, which is probably not massively useful for everybody here, but I think it's important. I think one of the things for me is that, just to echo what Candace was saying there, that the research is not great at the minute. And I don't mean that in a disparaging way. What I mean is that we're still trying to figure out how to research this properly, how to ask the right sorts of questions, use the right sorts of techniques. At the same time, there is this clear signal in the public debates that actually the science is settled on this. And that's very much not the case. And I think we do everybody a disservice when we say that. And I think coupled with that, there's this sense of urgency that, we've got some studies that sometimes say that there is big negative effects. They're not great studies. And then we need to do something about that because those sorts of studies align with how we feel as parents and caregivers about what the impacts of these sorts of technologies are. And there's a sense of urgency to do something there, but we don't have a clear evidence base for what that looks like yet, what an effective solution looks like. So part of this debate for me that I think is really important is just trying to sort of calm things down a little bit and think a little bit more rationally about where do we need to focus our efforts and our worries, and what do positive outcomes look like?
And Jessica, would you like to comment on some of the top line themes for you here?
Sure, I'm not sure how much I can add beyond what the other panelists have already shared and summarized, because I totally agree. Nuance does not sell. And unfortunately, the situation at hand is highly nuanced and complicated and not yet settled. I think that one piece that stands out for me is because there's been such a rush into panic, really, and fear-based responses around what social media might or might not be causing or doing for youth mental health. Of course, it makes sense that the go-to response would be things like bans or mass restrictions. And that is really unfortunate, because I think what's lost in this conversation is not just, is social media harming, is the top line comment for everybody, but can social media help is a hugely untapped source of opportunity. I think the comparisons between social media and tobacco are very misguided, because tobacco has not revolutionized how we access information and communicate with one another. It doesn't have mass scale positive impacts as social media, whether we want to believe it or not, really does. If we listen to youth in this conversation, which youth don't drive media cycles and don't write books, so they haven't been centered in these conversations, we would learn how social media can be a lifesaver for a lot of young people. Absolutely, there are problems that are structural that need addressing, but those opportunities, I think, have been buried in the conversation, when I think really they're the bottom line. What we all care about is how to help young people thrive.
And on that note, Kelly, I'm going to kick it to you in just a couple moments, but I want to highlight just kind of a follow-up on some of the themes that have been highlighted just in the first question of this panel, which is that I think we can see unifying across all four of the panelists that have spoken thus far, is this notion of kind of taking the kind of panic level down so that we can actually understand what we know and what we don't know and get a little bit more into the nuances. At the same time, for anyone who's listening to this panel right now, shining a light on the crisis that does exist, I think, is important, in the sense that we all have seen really disturbing statistics about the youth mental health crisis within our country. And I think what we're highlighting even in the first points is that, you know, this notion that commonly what has often occurred is that we will see this crisis and people will think, well, the biggest change in the past couple decades seems to be an explosion of technology. What are we supposed to conclude about the effect of this technology? Would anyone like to comment on kind of, you know, the notion of this argument about what's driving the youth mental health outcomes that we see across the country right now, if not technology?
Yeah, I mean, of course, just because two things happen at the same time doesn't mean that one causes the other. And I think it's important to note that while we have seen changes in technology, and while there are many families who talk about tragic things that have happened, likely due to social media, and I don't want to, suggest that those are not true and real and tragic. We actually have seen difficulties related to the youth mental health for decades preceding social media or technology ever being introduced at all. Technology may have exacerbated some of what's happening, but remember that this is also during the time of a worldwide pandemic, of massive polarization. And we know that stress is one of the strongest predictors of mental health difficulties for youth. If you ask kids where they're experiencing stress, they're talking about academic pressures, school shootings, climate change, and existential threat. So it doesn't seem like we can jump to the conclusion that technology is the cause. I will say that in some ways it might be a very easy way out, because what most scholars think is that we have to face the hard truth that we have a mental health system that was built for adults in 1940, and we have not revamped the mental health system since World War II. It's still an adult-oriented kind of approach that does not take advantage of the science that we've developed in youth mental health for 80 years. So that's most likely what's contributing to this slowly increasing and now beyond a threshold that we can ignore anymore, youth mental health crisis.
Before we pivot back to another follow-up on that, Kelly, we've talked a bit, and actually Mitch referenced the notion of listening to youth. We're not going to ask you to speak on behalf of all youth, but if you could add some perspective just in terms of what you feel are the kind of major forces that you've witnessed in this kind of social media and tech space.
Yeah, thank you. So like everyone said, I think a lot of it is just there's a lot of developments on a lot of fronts right now in terms of the contributing factors to the mental health crisis. The kind of polarization, the political, social, economic crises are just a few factors. And I've seen that kind of play into a lot of my fellow peers and friends and colleagues that are experiencing mental health or negative mental health effects right now. And almost none of them have mentioned that social media is the sole cause. They say that yes, it is kind of an exacerbating factor, that it can worsen certain symptoms and certain effects, but none of them have ever kind of reflected on the idea that this is the main thing that is leading to all of their problems that they're facing right now. It's mostly school, it's mostly the pandemic, it's personal issues, it's college pressures. Now that we're kind of making that transition, so I think the main idea is there's just a lot of factors right now in terms of the challenges that youth face.
And Candace and Pete, both of you have written extremely cogently about some of the challenges that youth face that may be driving some of the mental health effects that we're seeing. Can you speak to anything in the research related to what Kelly just noted about the experiences she's seen amongst her peers?
Yeah, I think we sometimes forget, that children are embedded in complex systems, right? In families and societies, and have lived through a number of shocks over the last couple of decades. So, if we think back to teenagers today, they were born in the aftermath of the Great Recession, right? They've grown up in the United States in communities that have been plagued by deaths of despair. So one statistic we don't talk about enough is over the past 20 years, 1.2 million parents have died by suicide or by opioid death, right? And that number has skyrocketed as well. So if we want to support kids and we want to support their development, we need to support the families that are raising them. And that starts early, right? So we're hearing a lot of conversation this week, at least in the United States, about investment in early childcare and parental leave and all of those kind of basic structural things that just we have to get right in this country to raise healthy brains and bodies.
I think just following on from that, the idea of like supporting early childcare, I think it's really important. And I think one thing that we probably don't talk about enough or as much is that I think there is a group that is really struggling with their digital technology use, and it's our generation. So, I can remember when I got my first iPhone, I was an early tech adopter, and 2008 comes around and I get it and I'm like, wow, this is cool. This is like all the stuff that I saw in sci-fi TV shows and stuff when I was a kid. What do I do next? And I figured it out. We winged it, basically. We all winged it. It didn't come with a manual about how to use this. And we were lucky in a sense in that we didn't get everything all at once. It was phones, and then the App Store appeared, and then social media apps appeared, and things like that. But essentially, what we were doing each time that these things appeared is we figured it out. For some people that was fine. Other people, it really turned out quite badly. But I think as a generation, we all struggle with having developed really poor habits around our technology use. And when you talk to teenagers about this now, they can see that, right? They can see that that's what happened to us. And the problem is it's happening to them. There are digital literacy initiatives around. There's nothing that's particularly joined up at the minute, either nationally or globally, but there is stuff around and they know it exists, but they're also kind of winging it as well. And that's where we need to do something. I think we need to learn from our own mistakes, as it were, and figure out, what would we have benefited from when we first got our phones and things like that. And how did we navigate that time and try and not let that cycle keep repeating for our kids as well.
Yeah. So pivoting for a second, if folks are just joining us, or if we want to summarize kind of our themes thus far, we're trying to downgrade some of the panic around social media and screens in general, try to make more nuanced arguments, try to think more about what some of the driving factors in the youth mental health crisis might be other than connecting it just as a direct line between social media and the kind of, disturbing youth outcomes that we see right now across the field of mental health. From what we know right now, and a number of our panelists have highlighted the fact that we don't know enough, what do we feel like we do know about the risk areas that parents should be aware of? Let's talk about those. Mitch, you unmuted. I'm going to go to you.
Sure. Keeping in mind that I think that there is some content and some features and functions on social media that can be helpful to kids' development. There are some things that I think we have emerging evidence enough to say this is a warning sign. And until we have more research, parents might want to heed some of the lessons from this research. We know that content that explicitly teaches kids how to engage in disordered behavior, how to cut themselves, how to engage in eating disordered behavior, that's not good. And more efforts to keep kids from being able to see that content. We know that some of the ways that notifications or endless scroll or other kinds of features built in keep kids on for longer than even they say they wish they were on. Might be interfering with things like schoolwork, physical activity, sleep. If a child is telling you, I'm trying to quit, but I can't, whatever that is, that's something I think parents should, really should be very concerned about. And I do think there are some other ways that, especially when we look at things like cyberbullying, cyber hate, we would like to eradicate that from all discourse, but in a social media platform, there's the opportunity to try and help curb that or present better examples of at least not elevated and push it onto people's feeds, even if they weren't looking for it. So I'll just stop there. But those are a few things that I think, given the current state of science and our judgment as psychologists, we could say, there's really no argument that those are good things for kids. So perhaps moderation and looking out for some of those issues.
I think those are all great points. Would any of our other panelists like to add other things that we think we want to draw parents or caregivers' attention to about risks that have been mapped to some degree in the research?
I would add to that, not necessarily pointing out other risks, because I totally agree with Mitch. Those are the primary ones that research is quite clear on. But what we do about them, I think, is less clear. So, we're talking to parents and caregivers, and of course, parents and caregivers want to know, well, how do I stop this? Right. And the answer is no individual parent or caregiver can stop those things from happening. And that's really distressing, right? And I think the answers ultimately to these more structural, this particular kind of content really cannot be on this platform and cause any good in the world. Those are jobs for these companies and these businesses to address, or for legal regulation on these companies or businesses to address. The idea that any individual family member is going to be able to stop cyberbullying is unfair and really creates just opportunities for frustration and argument in parents trying to police or limit kids' online behaviors, when really exploration online and communication online is a really normative and often healthy part of development as an adolescent. Exerting autonomy and seeking opportunities to gain independence, those are all simply parts of life for teenagers. So this isn't necessarily a solution, and I'm not sure it's comforting to hear, but knowing that it's not something you're not doing, it's not something that you're neglecting or not doing enough of, that's causing these issues on social media for parents and caregivers. This is a broader structural problem that needs likely top-down regulation in order to be resolved.
Just to kind of jump on this point, because I think it's a really important one in the conversation. And I've said this a few times, but these two things can be absolutely true, right? We need to be tougher on tech and change the way that these platforms work, the way the algorithms work, and that will be a good thing, right? It is also true at the same time that we don't need to point to children to shame them, to create stories about this mental health crisis, to use them as kind of the tip of the spear in doing that for technology. So these are two, sometimes related, but, separate sets of issues, which I think is hard to hold, at the same time in a conversation.
Oh yeah, Pete, did you just want to
Can I just,
Go
yeah,
for it.
just on, yeah, that I agree with everything that's been said so far. And I think it's a really important thing for everybody to understand in this debate is that everybody wants the right outcomes, the best outcomes for kids. It is very much not, there are some academics who are bought out by the tech industry who are trying to undermine everything else that's going on. There are, we're interested in the best evidence and the right sorts of sustainable outcomes. And I think one thing that has struck me in the public debate around the effects of social media and screen time and things like that is that, and I totally understand this as a relatively new parent, that there's almost this sense that we want to protect our kids from all the bad things that are happening out there. And the horrible hard truth is you can't do that. And in a sense, I don't think we want to do that. The world is a really tough place, and we need to learn how to deal with it appropriately and have that sort of resilience. What that sort of means for some of these conversations, and Candice is absolutely right that these sort of positions around tech companies doing more is true at the same time that there are things that maybe we can do differently in our day-to-day lives, when we wait for the research to come around, is thinking about how we have conversations around tech use in the home and creating support networks, better support networks for children and young people, so that when they do come across something that they find uncomfortable or potentially harmful online, they can talk to people about it and they can work through it so that it doesn't translate into much worse harm. And we've not got a great handle on that as yet at the minute. And that's not, I'm not trying to disparage anybody there. I think that's just the nature of where we are in this conversation. But what we absolutely want to try and avoid as a big risk is kids hiding their tech use from their support networks, whoever that might be. It might not necessarily be their parents or caregivers. It could be a wider group than that. But the moment you start hiding tech use, that's when things can really start to go wrong.
I mean, Pete, I think what you also highlight in speaking about this kind of, we can't put the genie back in the bottle and we have to deal with the reality of the world at the moment, is a common parent impulse. And it's hard to hear in a panel like this, because the common parent impulse is, if your child gets made fun of at soccer practice, you pull your kid from the soccer team. If your child gets bullied at school, they've got to switch schools. If you are, exposing your child to a situation, every parent has that impulse to say, well, my child had a negative experience, so gosh, if I could just remove this from their life, I could protect them. But to your point, not knowing how to navigate the experience may do them even more of a disservice in terms of their development in the long run. That by pulling them and protecting them in that moment, it may make it so that they're less resilient to those challenges as they encounter them in the future. And to be sure, the digital world is yet another world our kids are going to have to navigate. And as you so aptly highlighted, that a generation of parents are still having difficulty highlighting or navigating, I should say. Kelly, in terms of some of the risks that we've discussed and the kind of national discussion around these risks, what are some of the experiences you feel like you and your peers have had online that have either perhaps convinced you that social media could be a force for good, or perhaps been disturbing or made it so that it's difficult to see social media as a force for good?
I think going back to everything that the researchers and the panelists have been saying is that it's both. I've seen both personally from my own use of social media, but also from my friends and peers. I've seen content that are very educational, very informative, kind of teaching you about kind of how to deal with maybe certain like psychological phenomena. It explains things to you, and it helps you kind of get a better understanding of what it is that you might be facing. And it's almost like a single session intervention, really, that I've seen on social media. But there's also a lot of, as we mentioned before, like those risks that kind of promote unhealthy behavior that Dr. Prinstein mentioned. There was a trend that I kind of noticed a while back. I actually worked through this as a project as part of Youth Mental Health Academy, where it was the romanticization of certain mental health disorders. And one of the examples was actually borderline personality disorder, where certain traits are kind of thought to be attractive in a way, and thought to, even though these are very unhealthy kind of behaviors, they are made to be very attractive and kind of made to see that if youth are able to do this, then they might be able to, like have some sort of higher standing in their community or friend group. And that's a very critical risk that I think should be assessed. But in my experience, also going back to something that Dr. Etchell said, it's not about parents having that resilience for their children, because some of the best students and the best peers that I've worked with that are able to regulate their use of social media and are able to kind of tailor their content are those that have had a very steadfast foundation in skills like critical thinking, in skills like emotional regulation. And it's their environment. Maybe it's their school, or maybe it's their home environment that has provided these skills for them. And it's kind of the background that has helped them to be able to recognize when certain content is not good for their health, and it's helped them to regulate their own use of social media. So when we talk about things like screen time, or like accessing negative content, or how to remove that from their lives, these youths are very adept at doing that because they have kind of the background skills to do so. And I think it's really important that parents and caregivers and households and even like educational institutions are at the forefront of this and teaching them those skills, basically.
It's also a really good point about giving youth the tools to take charge of their management of these things without putting it necessarily on all the adults in their lives, which we tend to do, is think about, how we can influence those adults. I'll also, Kelly, just great shout out on using the specific term from Jessica's research as you spoke about single session interventions. That was a really good kind of like cross reference in the middle. So listen, turning to some of the things that we might highlight about the kind of positive side of social media platforms and technology. Jessica, your research, you look at the role that social media can play as a platform for public health interventions. Can you tell us a little about that research and that work and some of the ways that we could see increased good from these platforms?
Certainly. So Mitch aptly noted earlier that our mental health system that we currently have, and it's the only one we have at the moment, was built in the 1940s for adults. And that doesn't help given the massively unmet needs of youth struggling with their mental health today. And one of the ways that my lab, the Lab for Scalable Mental Health, tries to help expand what the mental health care ecosystem that we have can accomplish is by trying out new ways and formats and places to deliver mental health interventions that can still be effective, that have nuggets of traditional office-based treatments, but in places where young people are actually going to seek help, which increasingly and more than any other format or setting is on social media platforms online. That is the first place where youth who often haven't disclosed their difficulties to anyone else in their lives, and often may never disclose those difficulties to adults in their lives due to fear of consequences or stigma or not wanting to burden their families, that's where they go for support. And whether we like it or not, they're going to continue to do that. So it's really imperative on us as mental health professionals, as intervention scientists, to adapt to how youth are actively seeking help rather than try to convince them to use the resources that we've created in the 1940s. And so our lab focuses specifically on a particular kind of intervention that's optimized for ability to scale digital interventions, and acknowledging the reality that how youth use social media is quick and in the moment, which means we need to make our interventions match that way of using the internet. So we study single session interventions, programs that are designed to have as much impact as possible within a single encounter, acknowledging the reality that there may not be other encounters. And whether we'd like there to be or not, that is how kids are online. So these single session interventions that we've developed and tested and now disseminated to more than 70,000 young people across the country, we tested them out in randomized controlled trials with kids with depression, anxiety, teenagers who were seeking mental health related search terms on Instagram or other social media platforms like Tumblr. And what our lab has done is we've partnered with nonprofit organizations that work with social media companies to embed digital mental health supports directly into those platforms, so that when the terms that Kelly, you were mentioning before, like people search for borderline personality disorder or depression or therapy or other kinds of content online that would ordinarily trigger a cascade of harmful content. We instead offer them in that moment one of the evidence-based single session interventions that we've developed. They take 5 to 15 minutes to complete, and they teach things like how what you do can shape how you feel, why and how you aren't stuck being depressed, even if it feels like a part of your identity, and what to do next to get out of these negative cycles of thinking. And by serving essentially these brief momentary interventions precisely at points where teens are seeking care in the spaces where they're seeking help, that's the very new way of getting interventions to young people. And that's what we try to evaluate. And right now, our interventions are freely available to use all over. We don't put barriers up to our interventions. And we're partnering with a variety of organizations and sectors to make sure that interventions live where youth seek help. And so social media, yes, comes with all of these problems that will require structural solutions, but they also open the door to reach youth precisely when and where they seek out help. And that's going to be crucial to actually making a dent in the youth mental health crisis.
So if I'm following and I'm trying to construct for myself the fact that our audience is likely, whether they're watching this live or watching a recording, parents or caregivers who are looking for answers and coming to us. And if we look at the last few moments, we've definitely given parents and caregivers a couple things to think about with regard to advocacy around the restrictions that technology companies might place that would help their kids. Kelly has highlighted an empowerment argument related to youth and for parents to have more confidence, in their youth's ability to manage themselves and take lessons and be able to take charge. Jessica, you've got probably a ton of people Googling your lab and the work that you do and making sure that their kids know about these freely available single session interventions they can access through social media, which is an enormous force for good. Turning, Mitch, to some of the messaging you do on behalf of the APA as Chief Science Officer, what are some of the other practical things that you are often saying to parents and caregivers about the ways that they can help kids manage social media use?
Sure. I mean, we don't know what the intent is behind tech companies. I echo what folks have talked about we need some changes to occur. But right now, it seems like the deck is stacked against parents and kids to be able to get the best things out of social media. Because it appears at least that there's a goal towards keeping kids on for as long as possible, even if that means feeding some content that might be more provocative rather than pro-social. I keep thinking, imagine if social media was built to improve kids' empathy and well-being. What a wonderful thing that would be. So as a result, what we've been talking about is really to scaffold and prepare kids. And what I mean by that is really helping kids gradually learn what is the purpose of social media? Why was it created? Was it just made by a bunch of nice people to help kids make friends, or are there ways in which they have to be aware that they may be getting pulled towards engaging in behaviors they don't want, or their data might be used for purposes other than what seems evident, and let them be smart consumers. I think it's important that we teach all kids how to handle cyber hate before they get online, because they're probably going to experience or witness it. We teach all kids what to do when they encounter mis and disinformation, because we are all experiencing that many times a day, and so on. At APA, we did put together kind of a brief kind of Q&A for parents to have about 9 conversation starters with kids and say, here's a way to just begin to engage with your kid a little bit more and help them to think critically about how to get the best out of it and how to avoid the worst kind of features. So we hope that that's the kind of resource that will get parents figuring out what's best for my child and my family and my community, and how to have a conversation that fits them.
And importantly, just as a quick follow-up, and then Candace, I'd like to move to a question I'd like to ask you about the context and what factors parents can be paying attention to in their community if it's not social media. But Mitch, just as a quick follow-up, there's a lot of discussion related to parent recommendations related to age limits. This notion of this is the age to get your kid a smartphone, or this is the age when kids should have access, to social media. In the messaging that you're doing to parents, Is there some research basis to these age limits? You're talking about having conversations. What would you answer to that?
No child wakes up on their 16th birthday suddenly filled with competencies they didn't have the night before. So it's really hard to use a number. We do know that some of our kids can be very competent in some areas and less competent in others. So it's really a decision for folks to say, my child seems to be very able to withstand pressure. They're very knowledgeable about some of the risks. I could see an argument for where a 12-year-old should have full access to everything that's out there because they're highly competent, just as well as I can see an argument for a 19-year-old that should not. So it really is about an individual assessment. Having said that, my kids are right at this age and we're dealing with this in our own home, as scientist and a parent hat conflicting with each other sometimes. And we're really trying to help develop a curiosity, a critical thinking, and to slowly introduce some of these devices and platforms at the speed that fits our kids. And we have 2 kids, and that's going to be different for the 2 kids. So I think that a lot of parents might relate or appreciate that this is a parenting decision in some ways.
And you highlight something I think is just, it makes the world so much less simple. It's one of these things where we would love for there to be a magical age at which everyone is capable of handling, any number of different things. But to ground something in the notion that you consider your kids' competencies, what skills they need to build to engage with a particular world, and that's the way you kind of design the gateways for your kids is, as we've spoken about many times on this panel, a much more nuanced way to approach this that isn't necessarily crisis focused, but is competency focused. But Candace, I would
just very briefly say, we also have to remember that, when kids are given the opportunity to, let's say, drive, we don't just hand them the keys because they're of age. We have training programs and we test their competence. And, imagine a world where we could say, gee, you've graduated to being able to see likes because you've demonstrated an ability to withstand that powerful influence of them. So
we also have missteps, and we take those as they come. I tell patients often about the fact that my mother, a psychologist, and my father, a psychiatrist, the first time they took me out driving, I knocked off 3 rearview mirrors off of cars that were parallel parked along a street. And I proceeded to stop the car and say to them in my overconfident teenage voice that it was impossible to watch both sides of the car at the same time during that driving. And we just had to kind of walk things back to get me to a point where my competencies were such that I wasn't using my teenage overconfidence to act like it was okay to rip rearview mirrors off of cars, but to be safe. So I started off in mall parking lots in suburban Georgia. But Candace, to pivot to you, you've written widely circulated pieces where you so cogently make arguments about where the concerns might lie with social media, some of which we've mapped during this discussion. At the same time, again, for parents listening, if social media isn't the thing that they should be rallying their community around, what are the factors you try to draw community's attention to that we should be thinking about?
Yeah, so when I talk to parents, the first thing I try and communicate is that, we've got this. So sometimes we'll act like technology enters the room and has created a new species of children and adolescents that need completely different things than they needed before. And they don't, right? The things that we've been talking about today, Pete, right? With strong parent-child communication, with digital literacy, critical thinking skills. So all of those same kind of skills that we've been working really hard and failing at as parents, we just got to keep doing, some more of that because they're going to generalize into that relationship. I mean, the other thing that I often talk about, and I try and do this with my tweens, is look at the kid and not the phone, right? So I'll often ask, is your child sleeping okay? Do they have friends? Are they doing okay in school? Do they have something extracurricular they're engaged in, right? And if those things are going well, I'm less concerned about some of the phone use. I'm still looking at the things that Mitch has highlighted because I think those are important, to monitor, but try and see your kid and how they're doing across all these domains. And when you do react to the phone, just pause for a second and question whether it's really the phone that's, the issue here. Now, if kids are struggling offline, they're often struggling online, right? And so if you have a kid who you notice is a little bit sensitive to rejection, who might have trouble in peer relationships, they might need some extra supports as they enter that new setting, just like they're going to need some extra supports when they enter that new school. So I try and think about it and communicate with parents as another setting that our kids are going to go into, and we're going to need those same kind of skills around communication. So, my kids are at school today. I don't know who they're talking to. I don't know what they're with. I don't know what they're seeing. I need to extract that from them if I want to know. In the same way, we need to start having those conversations when our kids are online. So I have a lot of joy with my kids and sharing information online. The teaching goes both ways, which is kind of fun. My 11-year-old pointed out yesterday that I was falling for a fake video of like a little bear doing something. So, the digital awareness is working there. But on a serious note, I think we need to see past the phone and really, kind of see our kids and see what they need, and that's going to differ, across kids within a family, and might differ across, how they're doing as they ebb and flow through their life.
And
Yeah,
Jessica,
I might just add to that. I think this overall conversation, relates back to more broadly how youth are often structurally disempowered in our society. Young people have very little choice. Using the mental health care system as an example, in a third of states in the US, kids can't actually consent to receive mental health treatment without their parent or caregiver saying that they can first, even if they have needs. So the conversations around youth relationships to smartphones and social media has again kind of taken this, we are making the rules, we're just shutting this down approach, rather than one that pushes back and really focuses on what kids need, which is empowerment and autonomy and care and connection, right? And so I think, Candace, what you're really saying strikes me as really relevant to sort of broader discussions of trusting young people and assuming potential incompetency rather than inability to navigate on their own. And I think that overall theme, if that's sort of imbued into how parents and caregivers relate to kids about social media, assuming they have the skills to navigate this, and it's us trying to work it out together and learning from experience, that would be so worlds different than the current conversations and how they're directed.
I completely agree. And I think there's another layer on this, that there's nothing more terrifying to society than little girls becoming women. And so when we focus in on this conversation about girls, I think we need to be very careful where we're going. When I start to hear conversations about bans and narrowing in on young girls for behaviors that are very normative and sending the message that they are unwell, I immediately click to things that are not just specific to social media, that are bigger structural issues about how we support young people coming of age in this world. So,
and Candace, you speak of an ongoing dialogue in the country where, when large-scale negative effects of media were presented and people started to question that research, what I understand, I think you're referring to in kind of the zeitgeist, is that that research then kind of retreated to a kind of talking point of, well, actually, the worst effects are happening, for females around social media. What should people cut through in that research? And Pete, I know you also write about this in Unlocked, but I, figured it's probably a better idea to have females speaking on female mental health issues first, but then I'll go to you, Pete. But Candace, do you have more thoughts on how we should be unpacking that better?
Yeah, so I think, Jessica touched on a lot of this in terms of listening to young people and the lack of empowerment in these spaces. And so that we think about the positive ways that young people are using digital technologies. They're using it to connect, to get information. In some places, that's information about reproductive health, and some places that's information about safety, right? And so really thinking and understanding how young people are using this new set of tools to support their development and what they need to get out of the world, versus assuming, and I'm going to go back to a 1970s stereotype, that girls, when I was growing up, there was 5 guys in Hollywood that picked the female archetype of that's what beauty looked like. if you spend time with young people, go through their social media feeds, they are following people that they identify around culture, ethnicity, religiosity. The set of people that they can align with and the affinity groups that emerge out of there are so much more diverse and rich. So I think there's this tendency to default to these young, vulnerable girls who are vulnerable to, kind of the magazine stereotypical cover. That's a really simple story, right? And that's a really stereotypical story when development is so complex. And so I would just want to kind of put a warning sign when this narrative starts to circulate around and we're saving the girls. Are we, when we're banning them? Are we, when we're trying to control their access to something? And just pause with that for a second.
Can I add another warning label? Because I think something that gets lost in these conversations is that the groups of young people who often need social media most for these connections are the first ones to lose access to critical resources when we put up walls. So not just young girls, but sexual minority and gender minority young people often don't have anywhere else to go for community understanding and connection than the connections that they forge online, the affinity groups they find online, the information they find online. Our lab conducted a survey of hundreds of LGBTQ young people across the country and found that because the sex education they were receiving in schools was irrelevant for their lives, social media was where they went to find out that information. And it's a crucial resource and refuge for a lot of kids. And the least advantaged, the most disenfranchised kids are the ones that are going to be harmed first by overreactions and oversteps with regard to controlling social media access from top down. So I just want to put that out there too. I think it's definitely applicable to young girls, but goes beyond that as well into other intersecting identities.
And Jessica, I think you highlight something that, what the research has shown can be a matter of life or death for people with marginalized identities. That, this notion of limiting social media access, this can be helpful in suicide prevention when kids have access to those communities online. It can be helpful with their mental health and keeping them alive. And it's often kind of this thinking where we'll see groups say, well, I don't want children to be exposed to X online. And I think the pivot back is saying, do you want your kids to grow up safe and healthy? Like, to give them that community may be a lifeline, even as you navigate this yourself and try to feel your way through it. Pete, did you have anything to add to this discussion? I know there were a couple of times when I was about to kick it to you, but you may have. I'll just want to let you riff if you've got anything that you'd like to talk about related to the last couple of minutes.
I mean, this is all brilliant, so I can't add that much to it because I'm an idiot. But I'm conscious that we've got time, not much time left. But one thing that I will just say, in some of these discussions where we've gone, we were worried about youth mental health and screen time originally, and then we were worried about youth mental health and then social media, and then we were worried about teenage girls and social media. One thing that has struck me in these years and years of this sort of line of research is it's like the replication crisis in psychology never happened. Everybody's sort of forgot, not everybody, but like there's been massive like forgetfulness that what's happening at the minute is everybody's panicking, trying to figure out what happened in 2012 that caused mental health to go disastrously wrong. Is it this? Is it that? Is it this? Is it that? And these really compelling arguments for yes, it's this, or no, it's not that. And it's just nonsense, because this is all atheoretical, right? This is just people sort of reaching out and taking shots in the dark, and eventually you'll get a statistically significant finding or what looks like a really strong correlation, and you run away with it and you go, this is the one, everybody, look, you can't deny this. And it's just the wrong way to tackle this question, and it's the wrong way to do the science. And there are loads of good people doing good research in this area, and obviously all the people in this room are doing this, but that sort of narrative has taken hold, and it's that which really captures people, because it really plays into that fear that we've got, that there's something not right about this. It feels unnatural and unwholesome, because we've all developed bad habits with our tech, so we can relate to that. The thing that we often forget is that fundamentally these are technologies of entertainment, of convenience, or should be. So the good stuff that we get out of them sometimes we don't notice, because it's sort of become hygiene factors for us, right? So we forget that stuff and we focus on the negatives, and that's why we find ourselves in this cycle. And we really need to remember what happened in psychology 10, 12 years ago, and the lessons that we learned from that, and apply that to this area.
You highlight something that's so tough, I think, for humanity, the sense that the internet is built for nothing if not blame. And we are really good at figuring out where to point the finger, at least in online communities. So I'm going to ask Kelly one more question, and then I'm going to do a rapid fire final 2 questions with a panel where each person gives a quick answer. But Kelly, the last question I want to ask you is, from your perspective, what would be most helpful if the world was to listen to youth more about their experiences online and on social media? What should we listen more about?
I think well, it might be kind of like the opposite thing, but I think the youth's experiences in real life is mirrored by their experiences on social media. And so if we're going to find a way to kind of address that mental health crisis, starting with social media, I think it's really important that parents and households and caregivers and just their community around them kind of listen to what they are going through in their personal lives, because that is going to be reflected on what they might seek out on social media. On social media, it might be reflected on what they find and what algorithms are going to give them based on what they search. And all of that just comes back to their own personal experiences in their own lives. And these challenges that they're facing, obviously it might not be kind of the root cause of everything, but it is a very contributing factor to kind of that discussion around, can mental health illness be exacerbated by social media? And I think the answer is yes, but kind of again it comes back to their own personal experiences. And once that is sorted out, I think that again is going to be reflected on their use on social media. So really, if we're going to look at social media's impacts on mental health, kind of look at that kind of intersection between social media and their own like real life experiences.
It's a really important point, Kelly. So panelists, 2 rapid fire questions to end. Policymakers are going to policy. We've mapped the fact that we don't know a lot. And at the same time, policymakers are going to have to make policy for their constituents. In 1 or 2 sentences, what would you like to see more policy around based on the state of the science? Go.
Make tech companies accountable for things they know are likely causing harm. And no smartphone usage during instructional classroom time.
Got it.
Those are my 2.
Mitch, hitting both the legislative area and then the school level. Candace, Peter, Jessica, do you have a policy that you want to highlight that you feel like is supported well enough by the science?
Safety boards for tech companies, don't force it onto parents.
Great. Jessica or Pete?
I'm going to go, we need some sort of policy to improve the state of the research in the area, because what keeps happening at this, sorry, I'm going to go off on that, but the evidence isn't good enough for most policies in this area. It's not strong enough yet. So we need something to really kickstart, to really boost research so that we get that evidence base, and then we can do cool stuff like actual proper evidence-based national digital literacy initiatives for parents and kids.
Funding for research. Jessica, did you have something to add on the policy side?
I mean, all of these are great ideas, but I would say open science-focused collaborations between companies and research institutions, and kind of like, how these federal surveys track, the CDC and SAMHSA have these surveys that track the state of access to care and mental health and substance use. There should be some overarching study or collaborative body monitoring the state of social media and impacts on youth mental health that is not overseen by tech companies, where nobody ever gets to see the data but them.
And Kelly, any particular policy you want to direct policymakers to?
I would say kind of more integration based on just like the ideas that the other panelists have put out, just digital health literacy, the integration of that into our educational institutions, and kind of having a more structure, like just more content and more structure in that area, where students are receiving their education.
And Kelly, you teed up the last question in the final minute, which is, panelists, what is one resource or thing to read or view that you would send to our audience on this topic to empower them right now? What do you got? Mitch, you seem ready because you're unmuted. I'm just saying. But Candace unmuted herself. Yeah.
I like the curriculum at Common Sense Media. I think that offers some really nice resources to think developmentally about these issues.
Candace?
The blog post Techno Sapiens, written by Jackie Nisi, beautifully written, great advice. And there is an op-ed written by Ian Russell, who is Molly Russell's father. Amy Orban and him did a powerful piece yesterday on BBC4, really talking about his loss of his daughter, who was exposed to toxic content on social media, but talking about common sense solutions to making this work for kids. So powerful piece, Ian Russell, op-ed, The Guardian.
That's great suggestions. Pete, since we just threw it to the BBC in the UK, what run resource would you point folks to?
Oh man, I was really hoping somebody else would say my book, so I didn't have to. So I'm not going to say my book because that's I can't do. I can do. Honestly, I know this is going to sound a bit cheesy, but anything that you can find from the people in this room, the published research that they do, that's the kind of stuff that guided the thinking for my book, and it's brilliant and it's really accessible. So honestly, it's all great.
You're sending us all to the source material. Jessica, any particular resource?
Yeah, COI, this is our lab stuff, but so we have open access single session interventions available for anybody to use. They're actually free, not pretend free, like a lot of things on the internet. You can go to schleiderlab.org/yes. There's a suite of interventions, and schleiderlab.org/empower for an intervention for parents to help manage child anxiety by empowering brave behavior. Please use them. That's what they're for.
Thank you for that. So for folks who stayed with us for this long, thank you so much for joining us for this important discussion. Thank you to Dr. Odgers, Dr. Prinstein, Dr. Echtels, Dr. Schleider, and to Kelly for joining us. For those of you who are looking for CE credits, please scan the QR code on the screen at the moment, and please fill out the survey that you'll receive after this webinar. And for those of you who are looking to rewatch this discussion or to access other resources in the space of technology and youth mental health, please feel free to visit the Childmind Institute's website at www.childmind.org. And that, we will end the panel, and thank you all.